What brought you in today?
So I've been having a bit of issues with my knees squatting.
Okay.
After I try to squat, they are very painful, unfortunately. So I've stopped squatting completely.
Okay.
And I'd like to get back at it. I noticed then the day after, they're really sore, so it's affecting my running.
Okay. And when did this problem start coming on?
I think it's been like ongoing for years. I
Okay.
just kind of pushed through it.
Okay.
But I hit a point with the weight that I was lifting that I couldn't get any heavier without really hurting my knees. So.
And what weight was that?
Like 95 pounds, not a lot.
Okay. And if you had to kind of show me exactly where you feel the discomfort, in the knees first and then in the hip?
The knee is usually on the outside there.
Okay.
The hip is harder to describe. I just feel like a tightness.
A tightness, okay.
Yeah.
And how's your general health overall?
I would say pretty good.
Yeah? Okay, great.
Try to eat healthy and
Okay.
work out a lot.
No medications?
No.
Okay. And have you seen your doctor for this injury?
No.
No. Okay, so there's been no imaging in the form of an x-ray or an ultrasound or anything? Okay. So overall your goal is to return to squatting, ideally get back into more longer runs.
Yes.
And just get this pain resolved.
Yes.
Okay. So I want to see you squat. Maybe take a step to the left. And I just want you to do what you would normally do as a squat. Okay, good. What I want you to do is just stand on your right leg for me. Right leg only? Yeah, good. And do you have any pain?
No, I'm just not very stable, just in my ankles overall, I feel.
Just the right one or the left?
No, I would say equally.
Equally, you just don't
Yeah.
like to single leg stance? Okay. Well, if you need it, have the wall next to you just in case you need to grab it. Stand on just your right foot for me, and I want you to do a mini squat. And I just want to see how you control. Okay, interesting. Let's try the left side. And again. Okay. Both of those feel a little bit unstable for you?
Yeah.
Okay. Do a single leg squat, it's really noticeable. The angle from your hip to your knee definitely becomes more directed inwards. So let's try it again and I'll show you what I mean.
Okay.
So as you squat, you're going down. The angle from here to here really starts to angle across your body, right? You see that?
Yeah, and it should be
relatively straight.
Okay.
And what isn't stabilizing you well is the outside of your hip here, your glutes. Especially two of the outer glutes that are really important to try to balance the pelvis and keep the pressure from increasing too much on the inner knee. Okay, so we'll take a closer look and strength test those in our assessment.
Perfect.
Let's check your rotations. Does that feel the same as the other side as well?
Yeah,
Yeah. I saw your side body kind of flex with the internal rotation as well. Okay. I'm going to test the strength of those glutes that I was talking about earlier. So turn onto your left side for me. Okay, good. What we're going to do is we're going to make sure your pelvis stays in a neutral position. We're going to take this top leg, we're going to bring it up and behind your body. And we're going to turn your toes slightly up towards the ceiling, okay? I want you to hold your leg there, okay? Don't let me push you down. Okay, let's compare that to the other side. There's some weakness in your glute med. Okay, so bend the bottom knee just to give yourself some support. Keep that pelvis in neutral. And we're going to come up and back. We're going to turn that up towards the ceiling. Good. I want you to hold. Don't let me push you down. Okay. So this is what I was talking about, the important muscle on the side of your hip that stabilizes your knee. Definitely it's showing some weakness. Okay, coming down the outside of your leg. I'm going to take your leg and just stay relaxed. Take it up over and just let it fall. Keep it relaxed and let it fall. Okay. Do you feel some tension down the outside of your leg here?
Not really more.
I'm going to take this down with gravity. I'm going to keep the knee. Then we're just going to look at how it falls here. Okay. Do you feel a bit of a stretch?
Not really.
Not really? Okay. What happens when I bend your knee? Do you feel more of a stretch?
Yeah.
Okay, good. And relax again. Any pain with that? No? Okay.
No.
Just relax that leg. Any pain with that? No. Okay. And nice and relaxed there. Any pain with that? There. Nope. Good. All right. I'm going to test the meniscus. Any pain with that?
That's a little bit painful there, but nothing like.
Nothing too much?
Yeah.
Okay. And this side. Okay. Good. I think they said a little high. Okay. So I'm just going to glide your kneecap. Do you have any pain there? Nope. Okay. And is there any pain over on this aspect? Like, is that where you would feel discomfort?
Typically, yeah.
Yeah.
After I've exercised.
Through here?
That is weird, yeah.
All right, so I think what's going on is it's a bit of dysfunction down the whole chain, starting from some tightness in your spine.
Okay.
Obviously, I think the hip is involved, and I know it is. There's weakness in the hip and some tightness areas that we need to address. And all that is pulling on the kneecap differently, creating something we call kind of a malalignment of the patella, but a broader term is called patellofemoral pain syndrome.
Okay.
So basically, there's some things we need to do in the hip to help take some pressure off the knee. There's areas of the knee that we can strengthen that will also help.
Okay.
There's some taping strategies we can use to help offload the kneecap and trying to keep it centered.